Hi, my name is Dr. John Lucio. Welcome to our YouTube channel, J&J House. I practice integrative medicine and pain management in Jefferson City, Missouri. And this is my wife.
Hi, I'm Dr. Jennifer Su. I practice conventional gynecology and integrative medicine. Welcome back to our channel. Today's going to be about hyperthyroidism, and the most common one is Graves' disease. How we're going to organize today's video is he's going to give a really good background and history, because history is really important. It kind of helps us remember things about the actual disease, some interesting facts. Then we're going to go into our most favorite, which is both conventional treatment and our integrative treatments that are available to you. If you haven't subscribed, please go ahead and do so, and always hit that notification bell down there so you know when we've uploaded our next video. And please comment below on what topics you would like us to cover in the future. We appreciate it. We do 1 to 2 videos a week. Next week we're going to take a break because we're going to be out of town. And then always comment what you'd like to hear about in the future. That's what gives us our content.
So, as Dr. Su mentioned, I'm going to start with just a little bit of history. Graves' disease was described by an Irish physician named Dr. Robert Graves in 1835, which was interesting. 5 years later, a German physician also described it in 1840, Basdo. I hadn't realized that Dr. Graves had already discovered it before, and what Dr. Graves had seen, he had described patients who had swollen thyroid glands and had what is called exophthalmos, which is a swelling of the tissue around the eyes. As you see it with people who have overactive thyroids, they will have almost like a bulging eye effect. And so it went on from there. And at the time, Dr. Graves really didn't know what the causes were. So at that time, they had not done much study in terms of how antibodies work and how autoimmune diseases impact chronic disease. He was just making an observation. Some of the background regarding Graves' disease about, if you look at hyperthyroidism, it's caused by many things, but about 85% is caused by Graves' disease itself. And Graves' disease is thought now to be really kind of an autoimmune effect. In other words, our bodies make these antibodies to our own thyroid gland. And that seems to be the main cause, and they've actually been able to identify antibodies to the gland. Now, the antibody itself functions much like what is called thyroid stimulating hormone. This starts to create an increased amount of T3 and T4 in the body, and that's what creates the hyperthyroidism. Now, some of the risk factors that seem to be evident with hyperthyroidism, it seems to occur between the ages of 20 to 40 years old. Seems to occur more in women than men, almost an 8-to-1 ratio. Genetics does play a role. Another interesting fact is that it seems to be more common in folks that are left-handed. The causes, as I mentioned, people don't really know exactly what does it, but do able to observe this particular type of antibody and some other markers in the blood. But emotional and physical stress seem to trigger this immune reaction in our bodies. Pregnancy seems to do it, and people that have autoimmune diseases already, like rheumatoid arthritis and diabetes type 1, also seem to be more predisposed to it. I need to mention pregnancy itself too. Sometimes that can trigger the onset of hyperthyroidism. Now, you may wonder, what are the symptoms of it, and do I have it? Well, typically their symptoms are a very hyperactive metabolism. So people tend to be anxious, exhibit a lot of nervousness. They tend to sweat more than usual. They may have some trembling of the hands and fingers. The heart seems to be racing sometimes with palpitations. Some people also experience some shortness of breath with it as well. And last but not least, it also has been shown to be a cause of erectile dysfunction in men.
Whenever you go to your doctor and you're exhibiting some of these symptoms, they'll do testing, and the most common are blood tests. And what they'll draw is a TSH, which is a thyroid stimulating hormone, a free T4, free T3, and also a form of an antibody against your thyroid, either the thyroid peroxidase antibody or the antimicrosomal antibody. When people have Graves' disease, these two antibodies are elevated. There's another test called the iodine uptake So it's a thyroid iodine uptake scan. And what they do is they actually tag iodine radioactively. It's taken up by your thyroid, so it'll show up in different areas of your thyroid, which area lights up on the radiographic scan, and they might use that test as well. The conventional treatments are radioactive iodine, anti-thyroid drugs, and surgery. And we are integrative physicians, so we do want you to work with your conventional doctor. We integrate care with your current care. So it's really important to be under the care of an endocrinologist that understands what you need for your Graves' disease. Whenever you use these next integrative treatments, you can use them alongside your other treatments, and some of these are actually that we're going to cover in the next section can only be used in mild cases of Graves' disease, and it's not appropriate if you have severe forms of Graves' disease. So the next section we're going to cover is our favorite, which are integrative treatments for Graves' disease.
Under the broad heading of integrative treatments, some of the things that you should consider are acupuncture, and that's been described in Chinese medicine, and they do use it for hyperthyroid states. Other include diet, especially foods that are considered brassica, such as broccoli and Brussels sprouts, peaches, and soy, and we're going to mention a few of these on the list here. Some things to avoid, such as caffeine, especially if you have palpitations. Caffeine can actually make those things worse. And also, if you have food allergies, make sure you get tested for that, because this also may trigger that effect as well. Stop smoking. Of course, that's good almost for everything, but that does apply here. And we've seen one mention of using cold packs to the thyroid, especially if you've got a very swollen gland. I'm not sure how effective that is, but I saw it mentioned in one of the studies. Now, we're going to cover some of the supplements that are commonly used. They include calcium citrate, coenzyme Q10, vitamins A, C, and E, and those have been shown to be depleted in folks that are hyperthyroid. Now, be cautious if you are you a smoker and you have a history of lung cancer and you're taking vitamin A, because actually some studies say that increases your incidence of it. Selenium, L-carnitine, and zinc are some others that are used as well. Now again, when you are using these type of supplements, make sure you're telling your doctor that you are using them, because they have been shown to be effective in certain cases and not in others, so be aware of that.
The next section I'm going to list herbs that can be used in conjunction with your traditional conventional treatments for Graves' disease. They are as follows, and I didn't want to forget any of them, so I'm going to go ahead and read them off the list. Boogleweed, club moss, umbilical officinalis, ginger, lemon balm, milk thistle, motherwort, and turmeric.
Now, what's interesting about motherwort and bugleweed that you mentioned before, in Germany, in their Commission E, which is much like our FDA, it's actually considered approved for treatments of mild hyperthyroidism. All right, folks, that's it for today. Thank you so much for joining us.
We hope you got your tickets for the upcoming first annual Healthy You conference, where various local physicians that are prominent in their field of integrative medicine will be talking on different medical topics. So go ahead and go on to www.healthyuconnect.com and get your tickets now. It's an early bird special.
And this week we're going to be doing for our J&J check-in is ashwagandha. It's an Indian herb, and it's used for a lot of medicinal purposes.
See you then.